Good afternoon, Mr. Deviney. My name is James Sloan. I'm going to be a student physical therapist today. How are you doing?
Doing great.
Okay. So today we're going to be doing some manual lymph drainage and some compression therapy. I see that you have an affected left upper extremity with lymphedema. So for these treatments, I'm going to need to be able to touch you. Is that okay?
Yes.
Okay. All right. It looks like you're draped correctly for this procedure. It looks like our workstation is pretty clean. I've got all my instruments here. I'm going to go ahead and wash my hands real quick. So are you comfortable at the moment?
Yes.
Okay. So I'm going to go ahead and explain this treatment a little bit to you. I'm going to be providing a light massage pretty much from your neck down to your groin and then back up. Manual lymph drainage is going to increase lymphatic and venous return. It's going to stimulate lymphanogens. It's going to increase lymph production, as well as it's going to be soothing and analgesic. So it's going to be good for your pain. It's going to relieve your pain a little bit. So I just want you to relax as much as you can during this procedure. And before we continue, let me ask you a few questions just to make sure this treatment is correct for you. So I want to make sure that you don't have any history of cardiac edema, correct?
Nope.
No? Okay, so you don't have hypertension that you're not taking medication for?
No.
You don't have any renal failure?
No.
Are you currently sick? Do you have any viral infections at the moment? No. So has your doctor said anything about having a DVT before?
No.
And you're not asthmatic?
No.
Okay. So before we continue, I just want to check your sensation and your skin to make sure you don't have any skin lesions at the moment. So what I want you to do for me is, can you please close your eyes, and any time that I touch you, I just want you to say yes, okay?
Okay. Yes. 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 Yes.
Okay. Looks like everything is intact. So before we continue, do you have any questions?
No.
Do you think this is a viable treatment for you?
Yes.
Okay. Let's continue. And so I'm going to start on your supraclavicular area, just stretching your skin to its elastic limits. I'm going to do this 3 times. Normally I would do it 5 to 7 times, but for the purpose of this video I'm going to do it 3 times. Okay, go ahead and relax your arm for me.
Okay.
I'm going to expose your inguinal. Okay, Mr. Devaney. So, I'm just going to talk to you a little bit about what I want you to do when you leave here. I want you to make sure that you're not wearing any tight clothes that are tight around the chest. Okay. When you get in the shower, try to take a lukewarm shower, or at least nothing that's too hot. When you're using any kind of cream, make sure it's hypoallergenic. Non-fragrance that goes with that applies to any soap, shampoo, anything you use as far as laundry detergent goes. If you're using lotions on your skin, Vanicream or Aveeno is good. You want to make sure you apply that 2 times a day, especially before you do any compression bandaging, which we're going to do next. I want you to make sure you don't do any heavy lifting, especially with your children. Any deodorants, make sure they're also unscented. And if you're measuring your blood pressure, you're getting it taken, make sure that you get it on your right extremity. We don't want too much compression on this one with blood pressure. So next up is going to be, I'm going to show you how to compression wrap your arm. Okay, so are you comfortable? How do you feel right now?
I feel great.
Okay, do you have any questions so far?
No, sir.
Okay, well, let's get you dressed up and ready to go for compression, all right?
Okay.
All right, Mr. Devaney. So we're going to move on to compression bandaging right now. The main goal of this compression bandaging is to maintain the decongestive effects of the manual lymph drainage, which we just did. Some other effects of this are going to be also increasing your lymph and venous return. It's going to also increase the effectiveness of your muscle pumps when you're moving. As well as providing a increased working pressure and a decreased low resting pressure. This also helps support tissue elasticity. So basically what I'm going to be doing is I'm going to be applying a finger bandage to your fingers. then some padding all the way up your arm, and finally some short stretch compression bandages, making the pressure a little bit more down here towards your hand and a little bit less up towards your arm. Okay. So before I continue, I just want to again inspect your skin. It looks like you don't have any skin lesions right here. Can I get you to turn your head to the right and close your eyes and just say yes when I touch you?
Yes. 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 Yes.
Okay. Before we continue, I just want to ask you a few questions and make sure that we can go ahead and continue. You don't have any rashes that you're aware of right now.
No.
I don't see anything. That's good. I don't see any distended veins, and you don't have a history of varicose veins, correct?
No.
Okay. You don't have congestive heart failure.
No.
No. You haven't had any recent fractures in your arm.
No.
And have you heard of anything about your ankle brachial index being less than 0.8?
No.
Okay, perfect. So what I want you to do is, when I'm doing this, I just want you to watch me because I want you to be able to do this on yourself eventually. So the first thing we want to do is go ahead and apply the sleeve. Go ahead and slide your hand through there for me. Okay. Go ahead and roll this up a little bit. Okay. Start on the finger padding. Okay, and when we're doing this, we want to you want to make sure that you don't see any discoloration, any bluing of your fingertips. You want to make sure that you're not feeling any difference in sensation, you're not feeling any numbness. So I'm going to go ahead and finish with this finger wraps. Normally I would cut this off, but I'm going to go ahead and wrap this, just making sure that it's not getting accumulated in one area. Okay, so can you go ahead and make a fist for me? All right, good. And just want to make sure that you have your palm is clear. Okay, I'm going to go ahead and put this over your thumb real quick. Okay. All right. Now I'm going to be applying some padding. So what this is going to do is this is going to try to make the circumference of your arm the same all the way down. Okay. So can you make a fist and put your fist into my chest real quick? Okay. We're going to try to make this a little bit thicker down here on your forearm, since your forearm is a little bit smaller than your upper arm. Okay. Can you bend your elbow for me real quick? All right. Comfortable?
Mm-hmm.
All right. So now I'm gonna go ahead and start the short stretch bandaging. So what I'm gonna do is I'm gonna start down here at the wrist and go to your thumb after I've got this locked in. Okay. So I'm gonna come around the thumb 3 times. I'm gonna pinch and go through. 1. Pinch. Okay, and like I said before, with this, we're going to try to make the pressure a little bit higher down here towards your forearm. Okay. So I'll go ahead and apply this bigger short stretch bandage on you. And now that I've finished with this one, I want to go in the opposite direction this time. Okay.
Okay.
And I'm going to feel for your elbow. Okay, so when you go over the elbow, I want you to skip it, come up here, and then come back down and cover it. Okay, so you're going to need 2 sleeves, all right? I want you to wash one every day. When you get a new one, make sure you wash it 5 times, and then also use some white vinegar to wash it. As far as skincare, follow up with the same skincare as I told you for the manual lymph drainage. And you need to replace each garment every 6 months. Want you to wear these every 24/7, except for when you're doing personal hygiene, so in the shower or whatnot. If you're on long car rides. Okay, so when you remove your bandages, I want you to make sure that your skin is still intact. Okay, you don't have any lesions, any cuts or anything like that. I want you to apply your lotion before you put on your bandages. Okay, and like I said, make sure that your lotions are have low acidity, like a pH around 5. You want to make sure they're hyperallergenic, non-fragrance. So I'm just going to go ahead and feel this all the way up. Make sure there's no soft spots. Everything looks to be pretty solid. You make a fist for me real quick. Okay, flex your elbow. Good. Okay, everything looks good. So do you have any questions?